I am Ruth McEwen, Advisory Council member serving on the Northwest Senior and Disability Services Advisory Councils. I want to welcome candidates, incumbents, and Advisory Council members to the 2024 Candidate Interview Forum. This program features candidates and incumbents from districts serving Clatsop, Marion, Polk, Tillamook, and Yamhill counties and is sponsored by our Senior Advisory Council and our Disability Services Advisory Council. Northwest Senior and Disability Service is a local governmental organization that provides Medicaid, Oregon Project Independence, Older Americans Act, and grant-funded programs. The mission of the Northwest Senior and Disability Service is to promote dignity, independence, and health, honor choice, and empower people. The assistance and support we provide to consumers includes information, assistance, in-home and community-based services, financial and medical help, meal site and home-delivered meals, options counseling, adult protective services, Medicare counseling, and peer mentoring, money management, as well as health and wellness programs. Because of the number of state legislative districts that our service area covers, we have invited a large number of candidates to our candidate interviews. Each candidate has been given information on the format used in these interviews. Each candidate will be introduced by a member from the advisory councils, and then candidates will have the opportunity to answer questions which will be timed. We thank these candidates for their willingness to share their views about services for Oregon seniors and people with disability.
Hi, my name is Cheryl Statz, and I'm a member of the Senior Advisory Council and Disability Services Advisory Council at Northwest Seniors and Disability Services. Today, I'm interviewing Chris Wright. She's a Democratic candidate for Oregon House District 23, and will be asking candidate Wright questions related to seniors and people with disabilities. Welcome, candidate Wright. Thank you for sharing your time with us.
Well, thank you for the invite. I sure appreciate it.
Well, tell us about your platform and experience that would encourage a senior or person with disability to vote for you.
Well, part of my platform, I will compartmentalize it down to the elderly and disability issues. Healthcare, prioritizing healthcare programs that directly benefit seniors and people with disabilities, including preventative care, mental health services, memory care, and long-term care. Affordable housing. I will introduce bills providing affordable housing, options for seniors and people living with disabilities on a fixed income, accessible infrastructure, funding to be allocated to ensure public spaces and transportation are accessible for all, including those with disabilities. In-home and community services, programs with services that help people live independently in their homes and communities. State funding for programs that offer meal delivery, personal care assistance, and other in-home care services. Education and training. For people with disabilities, state funding is to be used for programs that provide education, job training, and placement, helping them to participate fully in the workforce. Support for caregivers, big one. Provide support for caregivers through respite care programs or financial assistance, as many of our seniors and disabled people rely on family and friends for their care. And the big one, family law. Provide elderly and disabled persons an attorney when filing a restraining order in the event the need arises for protection. It's called, well, elevating the EPPDAPA, elderly persons and disabled restraining orders to a 2-year renewal equal to that of the Oregon legislature when they changed the family protective orders from 1 year to 2. That the elderly orders need to be raised to be equal to that. And I was actually in a hearing when I got to witness one of those, and it was so hard for the elderly person experiencing all the stress and trauma to be able to tell the judge what was needed in order for that protective order. That's something that essentially needs to be in place in our society. Why you should vote for me? I was in the fight of my life against the US government in an on-the-job injury. I was in an elevator free fall while raising a special needs child who is now a pharmacy manager. Recently, I have become my 90-year-old father's only and sole care provider. Seniors and disabled voters, I have lived the tidal waves of mitigation, frustration, and justice, thanks to Governor Elizabeth First and Senator Wyden, who took the time for me. I will work, fight, and advocate for seniors and persons living with disabilities, like like was done for me. And that is my platform. Thank you.
Thank you. So how would you prioritize state funding, including funding that is matched with federal funds, such as Medicaid, for services to an ever-expanding number of seniors and people with disabilities?
As a state legislature, I would prioritize state funding for services to seniors and people with disabilities through various programs and initiatives managed by the Oregon Department of Human Services, ensuring stability for those served. I will advocate for the expansion and reach of programs that continue to achieve cost effectiveness for state budgets while maintaining Oregon's commitment to supporting the independence of our adults and people with disabilities through comprehensive and accessible services, such as Aging and Disability Resource Connection, community services and supports. That things include things like Meals on Wheel and cafeteria style dining, and transportation infrastructure, similar to accessibility ramps, healthy aging, healthy aging programs. The state funds evidence-based interventions to help older adults and peoples with disabilities manage and reduce pressure. One of the last ones is Medicaid and long-term care, Medicaid home and community-based service, especially the Oregon Project Independence and OPI/M. Oregon Project Independence is a significant cost diversion program, one of the only alternatives for diversion that exists in Oregon. OPI has a waiting list. Ineligible for OPI-M also. You have to be an existing OPI member to receive OPI-M. OPI-M is Medicaid, a variety of home and community-based services that require assistance for individuals who require assistance with their daily living activities and are at risk for requiring long-term services and support via Oregon Medicaid, Oregon health plans such as state plan personal care program. This includes adult daycare, emergency response systems, meal delivery, home modifications for safety and accessibility, and personal care assistance. There is also a family caregiver assistance component. Informal, unpaid caregivers of OPI-M beneficiaries can receive education and training specific to the needs and the care of the care recipient. Respite care is also available, giving caregivers a break from their caregiving duties. Unstable funding of OPI has left this program with massive fluctuations that are difficult to manage for consumers faced with uncertainty in their future within the program and for the staff who administer the OPI. There is also enhanced mobility of seniors and individuals with disabilities. Service priority levels are how the state determines your ranking Seniors and persons living with disabilities should be automatically assigned a service priority level. Range, I fill in the range of 1 to 5, reflecting levels of physical and mental impairment, indicating a need for assistance for state and federally funded services. Level 1 is the most impaired to 18, which reflects the least impaired. And that's the end
Thank,
of that.
thank you. It is becoming increasingly challenging for seniors and people with disabilities to obtain housing due to constantly rising housing costs and an insufficient supply of disability accessible housing. What will you do on a state level to prioritize affordable, accessible housing?
On the state level, I will champion bills for grants and loans within the UGB to remodel and or develop to ADA accessibility standards, including additional ADUs, cottage clusters, tiny homes, or dorm-style group housing to Oregon properties and their infrastructure. Keeping housing costs affordable to increase Oregon's accessible housing supply for seniors and disabled, but limited to Oregon properties zoned for mixed-use commercial and residential. As a planning commissioner for the city of Newburgh, this is not one of the things I see that comes before my commission. A new housing development in Newburgh, predominantly studios and one bedrooms, will rent for $1,800 to $2,400. Not what I consider affordable, and exclusionary to those not having an income 3 times of rent, which would be in the range of $5,400 to $7,200 minimum dollars a month. Affordable housing is an agreement transferred to an Oregon property for 60 years, ensuring it remains low income housing regardless of ownership over time. This does not guarantee accessibility of a unit set up for elderly and disabled. That's why we need to use our existing infrastructure. We've already got it here. Let's get some buildings going on, get our citizens housed in these, vulnerable populations.
Thank you. What would you support on a state level to prioritize access to healthy and nutritious food for seniors and people with disabilities?
Well, I support and prioritize funding for access to healthy and nutritious food for seniors and people with disabilities, Older American Act Nutrition Program, and Oregon Department of Human Services nutritional programs. And there's even the Senior Farm Direct Nutritional Program as one such initiative. Assisted living and residential care, they must provide a state legislator can make sure our assisted living and residential cares are providing a basic level of service that promotes the quality of life and independence. And I would also like to see this 3 meals a day in a group dining room expanded language to include in-room, apartment, or dwelling. Because sometimes you just can't get out, you don't feel good, but you need your nutrition. And under the existing law, if you were to eat your meals in your room, they don't have to legally accommodate that. Supplemental nutrition program is one of our biggest supporters for providing low income people, which are seniors and disabled, with the food they need to be healthy.
Thank you. What would you do to address the behavioral health needs of older adults and people with disabilities?
I support existing initiatives and advocate for their continuation and expansion. Behavioral health initiatives for older adults and people with physical disabilities funded by the Oregon Health Authority. Professionals who specialize in behavioral health for older adults and people with disabilities, and local and regional community mental health programs around the state. And I would like to identify as a legislator and address service gaps. I will advocate for legislative solutions to address service gaps by engaging with behavioral health specialists and key stakeholders, identifying and understanding the challenges and service gaps and how to address them. Behavioral health specialists that work with key stakeholders in their communities to reduce these gaps in services for older adults and people with disabilities who have behavioral health needs. As a legislator, I will advocate for increased and expanded funding, the Older Adult Behavioral Health Initiatives, which provides training and resources for behavioral health specialists, workforce development and training programs that enhance the capacity of local communities to address the behavioral health needs of their communities by supporting the implementation of evidence-based interventions that provide skills and training to enable older adults and people with disability to successfully manage and reduce depression, anxiety, and substance abuse. We need to keep our behavioral health issues front and center. Major challenges to behavioral health initiative for older adults and people with disabilities is to keep these issues of these populations front and center, locally and at state levels. Legislators can advocate for better collaboration and coordination of services to provide a comprehensive and integrated approach to addressing the behavioral health needs of older adult and people with disabilities.
Thank you very much. We've been visiting today with candidate Chris Wright, a Democratic candidate for Oregon House District 23. Thank you, candidate Wright, for joining
Thank
us
you.
today for this interview.
It's been a pleasure, and thank you for doing all that you do. Have a great day, everyone.
I want to thank the candidates on behalf of the members of the Senior Advisory Council and Disability Service Advisory Council of Northwest Senior and Disability Services for attending our candidate interviews. We hope the information that has been provided will help you make informed choices when you vote. The opinions expressed here are not endorsed by Northwest Senior and Disability Services. For more information or to get connected to services provided by Northwest Senior and Disability Services, call 1-866-206-4799. The advisory councils for Northwest Senior and Disability Services would like to thank Capital Community Media for their production of the forum. Thank you for watching.